Okay. You ready?
Yes.
Okay. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. My name is Hamza Reed, and I'm the Director of Operations here at the Multicultural Center. And I'd like to welcome you all to our Family First Center's weekly Wednesday webinar. Alhamdulillah, now presented in cooperation with ISGH and Anissa Hope Center. This happens every Wednesday at 11 a.m. The format usually consists of a short presentation followed by a question and answer session at the end, where we will field questions from the audience down in the chat box below. Today's exciting topic is understanding mental health, or should I say needed topic, understanding mental health. And it will be presented by Sister Saima Husani. A little info about Sister Saima. She's a licensed professional counselor, a supervisor with the state of Texas. She earned her Bachelor's of Arts degree in communications from Texas A&M University in College Station, Texas, and her Master's of Arts degree in educational counseling from the University of Phoenix in Phoenix, Arizona. After completing her graduate degree in Arizona, she has experienced as a K-12 school guidance counselor in the state of Arizona, and has earned extensive experience working inpatient and at psychiatric hospitals, outpatient clinics, and in private practice working with adults, couples, and families. So without further ado, I'd like to hand it over to Sister Saima.
Thank you, Brother Hamza, and assalamu alaikum, everybody. I'm glad to be here again this month and this week for this topic. I think it's, especially in these times with everything going on with the climate in this country, the global climate with the pandemic, it's very stressful for a lot of us. We're experiencing a lot of anxiety. Some are experiencing depression, mood swings, panic, and so there's a lot of things that are going on, which sometimes we wonder, is this just normal human emotion that I'm experiencing, or is this something beyond that? And I think that's something that needs to be clarified sometimes, because a lot of people wonder, like, is it, because we all have emotions, we all get stressed out, we all get sad from time to time, but when is it considered mental illness? And that's what I wanted to kind of touch base today and talk about, how to understand, the differences between just a regular human emotion and something a little bit more serious than that, and when to seek help. And also, to kind of go over some of the more common things that we hear about. We hear about anxiety a lot. We hear about depression. We hear about bipolar disorder. So I thought I might just kind of briefly go over what those are. And then talk about some of the stigmas that are attached to mental health, and what are some of the barriers that come into play when people are experiencing these things and they hesitate to seek help. So that's what I thought we'll talk about today. What is the difference between feeling emotions and when is it considered a mental health concern? Sometimes, we will feel anxiety when we're about to give a speech or we're about to go in for an interview. That's normal. That's a normal reaction to those situations. Sometimes we will feel, we'll be shy. We have a tendency to maybe be introverted as a person. But when does that become different from being or having social anxiety and not being able to interact in social situations? So these are the kind of questions that we want to cover. Basically, mental health becomes diagnosable when these kinds of things start to interfere with your ability to function on a day-to-day basis, when they inhibit, you from maintaining personal or family relationships. You don't want to socialize, you want to stay isolated. And again, we're talking about for a prolonged period of time, where it's kind of, like I said, it's inhibiting your ability to function on a day-to-day basis. You're having difficulty functioning at school or at work. You're not able to focus, complete tasks, and that kind of thing. So it's not letting you do the things you would normally do. You're not wanting to participate in activities. So that's the kind of thing that you want to be wary of and look out for when trying to figure out, is this me just feeling upset about something, or is this something more? Because, depression, as they say, is something like, we can be sad about an event. Something happens and we can get sad. Something happens and we can be disappointed. But when it's clinical depression, I often hear people say, well, everything seems to be going so well. I have a great job, I have a great family, I have a pretty good life, but I'm just still feeling down. I just don't have that motivation. And so that's when there's something more, underlying that's going on, and something that's where you need to seek help. Um, you also have to be kind of mindful about cultural norms, because sometimes in certain cultures, certain behaviors and expectations are normal versus in other cultures, they're not. So you have to remember what's normal in one society may not be considered normal, so to speak, in another society. So that's another thing to be mindful of. How are mental health conditions defined or diagnosed per se, right? As health professionals, we use what's called the Diagnostic and Statistical Manual, the DSM. That is a book that talks about all the conditions that are out there, what are the criterias to meet those conditions, and we use that as a guide to determine, okay, what's going on here? Are there certain criterias that are being met? 5 out of 7 symptoms that we see happening over an X amount of time consistently. So then, okay, there's something going on. Other things to consider that might be leading to mental health concerns are things like, is there a medical history? Is there a family history there in your family of mental health issues? Because a lot of them are genetically, there is a genetic link between mental health conditions, just like physical health conditions. Mental health conditions are also hereditary, which doesn't mean that just because there's a family member with a history of, there's bipolar disorder in your family, or there's depression or anxiety, that you will necessarily have it. You're just at a higher risk, as just like any other disease. Things that can add to that, if there's traumatizing events in your life, if there's life changes, things like divorce, death, trauma, abuse, these things can maybe, accelerate or impact the likelihood of it occurring for you, because those are external factors that are more risk factors for you. So you have to keep that in mind, what's going on in your life that may be contributing to the way you're feeling, and what's genetically at play as well. Also, before jumping into medications for treating mental health illness, I always explain or encourage my clients to seek out medical advice with their primary care physician, to see if are there any underlying health concerns at play. Because a lot of times what happens is that physical imbalances can look like and present as mental health symptoms. Like, for example, if you have a thyroid imbalance, thyroid imbalances can look, they have low energy, fatigue, mood swings, and the hormonal imbalances can also look like that. So that can look like, it might be like, depression. But if we just kind of get that in check, then you might start to feel okay. So it's always best to kind of rule out everything else physically that might be also at play, that may be presenting like a mental health symptom. So, because I know a lot of people are reluctant to start, psychiatric medications, because they fear the side effects. They fear that it's going to make me feel numb, or I'm just going to feel flat all the time. So there's a lot of hesitation for psychiatric medications. So I always encourage people to just get an overall wellness check, get, a physical done, make sure everything is within range. Sometimes mineral and vitamin deficiencies can cause symptoms of what looks like mental health concerns, low B12, low vitamin D, magnesium, these kinds of things can also contribute to the way we feel and our emotions and how our behavior looks like to others. So it's just good to kind of, just look into that before getting into, mental health treatment. So again, some of the things that you want to be wary of and be mindful of are any changes in reactions, behaviors, eating habits, sleep patterns. Sometimes if we're sleeping too much, what is going on here? If we're not sleeping enough, what's going on there? The inability to cope, feeling just overwhelmed and fatigued all of the time is also an indicator of something that, again, consistently going on for a long period of time. Feeling just kind of disconnected or withdrawn, and not wanting to engage socially with people that you would once normally your family or friends. You don't want to really be out there. You want to be alone. Excessive anxiety, the worry, the fear, what if thinking patterns. We all, like I said, stress is normal. It happens, especially in these days. And stress is normal when there's a situation which may be causing or impacting the stress, right? But anxiety is when it's the worry of, it's like the worry of the worry, like what if something happens? Like there's not necessarily a threat or some sort of a concern, but you're thinking, what if there is? So then that kind of builds on itself. And so what if this happens? How am I going to do this if that happens? And all of these racing thoughts are getting caught up in and spinning in your mind. And, that's what anxiety is. And then, you have other health concerns when it comes to excessive anxiety. It affects your blood pressure, diabetes, blood sugar level. All of these things are impacted by stress. And we all know that. It says, we've heard it, stress kills. And so it's really important to be able to manage stress and anxiety in a healthy way. Prolonged sadness, depression is something, or apathy, even just not caring, feeling like nothing matters. That's a red flag also, if you've been feeling that for some long time, because that can lead to suicidality, thoughts of self-harm. If there's actual behaviors going on that you're harming yourself and engaging in these kinds of things, that's a huge red flag, because then that's definitely signaling that there's something definitely going on. So any self-harm behaviors, suicidal ideation, that's very dangerous, and it's important to be mindful of that. Again, if you're falling into substance abuse, to kind of, it's serving as an escape for you from, you don't want to feel the negativity that's in your life and you're escaping from it. And sometimes it gets into substance abuse, alcohol, drugs. That's another red flag. Extreme mood swings, excessive anger, hostility, things that are out of the norm for your personality. And it's important to, when we're in it, it's hard to hear people tell you that they're concerned, because people around you that love you will notice these changes in you. But you're in a space where you don't want to hear that. You're either in denial, or you don't care, or you're going to, react with hostility and say, no, I'm fine. And that's what that denial is. So it's hard to, be in that situation and try to figure out when it's time to seek treatment. So it's, you're lucky if you do have a good support system around you, that people that can notice these changes and be supportive and encourage you to seek out treatment, because that's what's going to help in that situation. So let's go over, some of the more common kind of mental illnesses that we hear about, things like depression, anxiety, so just to quickly kind of understand what each of those are. Depression is basically just kind of a persistent feeling of sadness and a loss of interest in things. It can be called clinical depression or major depressive disorder. It really affects the way you think, the way you feel, and the way you behave, and just you're having trouble doing your normal day-to-day activities. And like I said, sometimes it makes you feel that life just isn't worth living anymore. And that's extremely dangerous. So it's more than just the case of the blues. It's not just, I'm just sad or upset because something didn't happen my way or things aren't turning out. It's just, you just can't simply snap out of it. Like, people say, well, you have everything going for you. What's wrong with you? It'll be fine. You'll be fine, and just snap out of it. It's not as easy as that. If it was that easy, I think a lot of people would, not suffer the way they do. But with, again, medication at times can be helpful for sure. It helps a lot of people, antidepressant medications, and psychotherapy, both of them as a combination, along with, again, first addressing any underlying physical conditions, can help you feel better. So, like I said, the symptoms of depression could be just the feelings of emptiness, hopelessness, sometimes anger outbursts, irritability that's been increased, a loss of interest or pleasure in doing things. You don't want to engage in any hobbies or sports. sleep disturbances, sleeping too much, sleeping too little, poor appetite, and all of these kinds of things that you feel just aren't letting me function the way I normally would, is when you can kind of see that, okay, this is something more than just feeling, the case of the blues. Um, Sometimes, it's in kids, it's hard because, especially when they're at that age, when they're transitioning from just being a kid into the teenage years, there's already those hormonal changes that are happening. They're already trying, kind of, for the most part, most kids, they tend to pull away from, they want to be on their own. They want that independence. So for parents, it might be a little bit hard to catch, but that's a very sensitive time in a child's life because there is that hormonal change and there is that transitioning from being just a kid to preteen, prepubescent, era. And so it's important to kind of look out for, how are they doing in school? How are they with their friends? Are they still hanging out with their friends? Are they starting to isolate more? Are their grades falling? How do they kind of seem at home? Are they irritable? Do they say a lot of negative, low self, negative self-talk kind of things that they say? So it's important to really be careful and watchful in that at that age for kids, because it can be, sometimes it can be missed. And it's important that you're there, you're engaged, you're, having hopefully good communication with the kids so that it doesn't go by and then they fall into something, more critical at that stage in their life. So, like I said, when to go see a doctor, when people in your life are pointing it out, that something's wrong, they're encouraging you to seek help, listen to them. Don't take it as a personal attack because they're just trying to be supportive for you. All right. So that's basically what depression, would look like. Anxiety, again, like I said, it's more about, that the feeling of anxiety or panic when you feel that you don't have a control over things, where you feel that the action, you think there's a potential danger or threat of some sort. So you avoid maybe certain places. You if you have fears or irrational fears, a fear of driving, a fear of being in public, for fear of something may happen. All of those things, that those what if scenarios, those thinking patterns are indicators that this is more along the lines of anxiety. Going from like 0 to 100. Within, minutes, about you're in a situation and then you just feel a panic attack coming on. You can feel your heart racing, you feel, your breathing becomes more shallow. And so those are indicators of maybe it might be a panic attack. And panic attacks can range from being mild to moderate to severe, where, you're hyperventilating and sometimes people pass out. So, and sometimes, they end up going to the emergency room thinking they're having a heart attack, but there's nothing wrong, with their heart. It's just something that they were feeling in that moment of sheer panic. So those are the, the concerns with anxiety, that it can lead to these kinds of situations. There's different kinds. Like I said, there's a generalized anxiety disorder, social anxiety, which is, social phobia, or there can be specific phobias, and there are ways, again, through treatment, through therapy, to process through them, to understand, your thinking patterns, your cognitive distorted thinking patterns. We talk about those in therapy, about a lot of times how we perceive things, how we think about things impacts, our feelings and what that emotion looks like. Because if we automatically jump to some negative situation in our mind without, any kind of evidence that there is something negative out there, then that's going to get us nervous. It's going to make us feel like I'm losing control. I don't know what's going to happen. And in those racing thoughts kind of start circling in our mind. So, common symptoms with anxiety are things like that nervousness, the restlessness, having that fear, the fear of some impending danger or doom. When you feel that heart racing, breathing rapidly, when you're perspiring, sweating, trembling, when you feel weak, these are all symptoms of what it feels like when you're having heightened anxiety. And again, like I said, if this is something that happens often or it's prolonged and it prevents you from doing the things that you would like to do. It prevents you from socializing. It prevents you from taking that interview because you fear the worst case scenario might happen. Those are impactful things and to be aware of. So, and again, when these things are, prevalent, it's time to go talk to somebody and figure that out, like what's going on. And then another one that I wanted to just briefly go over is, we hear a lot about bipolar disorder. And what is that? It's again, bipolar disorder used to be called manic depressive disorder, but that's changed. It's now called bipolar, and there's two types, bipolar 1 and bipolar 2. That basically talks about those extreme mood swings. You can have emotional highs, which are called mania, or hypomania, which is not as severe, and lows, which are the depressive states. When you become depressed, again, you feel the same symptoms of a low mood, hopelessness, a loss of interest. But when you have mania, those are times when you actually feel pretty euphoric. You feel full of energy, and you feel you're unstoppable. But that can, those manic episodes can be damaging because you might do things, you're becoming more impulsive, and your ability to think clearly and rationally is diminished in those manic episodes. And again, how severe it is depends on whether it's mania or hypomania. And it ranges. It can, last a few days, a few weeks. And the best gauge for seeing these things is, being open to have family members address this with you, or friends address these shifts in your mood when they see the differences. Because oftentimes we don't see it. We don't even notice it when it's happening. We just are kind of in it, and it's best to listen to when people talk to us about their concerns. So those are some of the main, or, there's so many more, but these are the ones we often hear about. People talk about, depression, anxiety, or bipolar disorder, and there's so many more, but, if you wanted to learn about those, there's so many articles and good information about different things. And you can always talk to your healthcare professional if you're concerned about anything else that you might be experiencing. So, how do we overcome the stigma of mental health? We often hesitate to talk about it because we feel it's some sort of a weakness, or something's wrong with us, and we don't want to admit it. We want to just kind of push it to the side and pretend everything is fine. And if somebody points it out, we deny it because we feel there's all these false beliefs about mental health. There's, unfortunately, there is a bias, there is a stigma still, but it's come a long way over the past many years. People are talking about it more. There is definitely more awareness. So many celebrities have come out talking about their struggles with mental illness and how it's impacted their lives, and it's led to addictions and different things and consequences in their lives. So it's definitely more talked about. I think it's important to be aware, not be reluctant to speak about it. I think raising that awareness is important. Raising awareness and understanding amongst, even if you just start with your family, like I said, sometimes culturally there's, people don't want to address it. It's shameful. It's, there's, how will people see you? They will be, you fear, that fear of judgment is there. But, mental illness is just like any other physical illness. It's something going on with your brain. Your brain is another organ in your body, just like your heart or your kidneys, that sometimes isn't working the way it's supposed to be working. So that, try to normalize it. It's nothing, that you're not crazy. That's not accurate to say that. And again, when something is not functioning the way it's supposed to be functioning, then you seek treatment. You go and you find help. You go to a doctor, you go to your psychiatrist or a therapist, and you talk about it. There's no shame in that. It actually takes a lot of strength to admit it and take ownership of it and say, you know what, I need help. I'm struggling. I'm not the person I want to be for my family. I'm not the person I want to be in my life. I'm struggling. I can't perform at work, or whatever it might be. It's okay to say that. There's nothing wrong with that, because you're taking it head on. You're not numbing it through something, because that's not going to get you anywhere. That's just a temporary fix for the moment. The thing is, to get treatment, it'll avoid, when you start feeling that, you'll gain a sense of empowerment, that, what, I'm doing something about this. And you'll see those changes happening. Like I said, don't let that stigma create that self-doubt or the shame that's attached to it. We're human. We need support, and it's okay to ask for help. I think a lot of times people hold back because they don't feel like they want to be a burden on their family or their friends, and they don't say anything. But it's not being a burden. If somebody came to you with something that they were struggling with, would you see them as a burden? You would want to help them, right? I think we forget that, and we don't show that same self-compassion towards ourselves as we do to others. The biggest thing in coping, with mental health is, again, try to go get that treatment if you can. And basically don't isolate yourself. Don't let yourself, feel that you're alone, that nobody will get this, nobody understands this. How did I let myself get here? It's not your struggle alone. It's okay to ask for help. And the other thing I often tell my clients is that don't identify yourself with that illness. Okay. Don't say, I'm bipolar. You have bipolar disorder. You are not your illness, right? You have depression. You have anxiety. When you want to learn to kind of separate yourself and who you are from the illness, right? That's just something that you have that unfortunately is going to be a struggle to an extent, but that is not who you are. So don't identify with your illness, because I think that also tends to bring us down a lot. There's many support groups online, especially these days with COVID. We can't really go physically to many places in a large gathering, but there's lots of online support that you can search, online support groups, and feel connected, and with therapy, you can seek out therapy with, again, your psychiatrist. Like I said, if it has to do with medication management or learning about medication, you can always go to the doctor and just get the information. If you're one that hesitates and are reluctant to medication, at least go and find out. Having information is not a bad thing. Whether you decide to take the medication, again, that's your choice. But at least find out what your options are. And again, look into overall wellness, vitamin deficiencies, minerals. What is your diet like? All of these things, it's all connected. It's all interconnected. So whatever we're putting in our bodies, it's impacting everything, including our brain. So, seek the treatment, go to a doctor, seek a therapist. Sometimes individual therapy is something that might be beneficial. And there's also group therapy. A lot of people benefit from group therapy because they see that there's other people who can relate. There's people out there who will understand you don't want to talk to family and friends because you're afraid of what they're going to say. So we do fear that judgment. Even if we have family and friends who are there for us, we don't want to, lean on them too much sometimes, because we don't want to feel like they're going to see us in a different way now. So being in a therapeutic environment, whether it's individual or group, is a safe environment where you can just talk about anything openly and freely and not be judged or criticized. And it's a safe space. Okay. So therapy is important in these situations. If you're a student, if you're in school, whether it's, elementary, middle, high school, college, there's support. Teachers are there. If you're going through something, there's school counselors that you can also turn to, if your symptoms are such that it's, diminishing your ability to focus in school. Let's say you're in college and you can't get your assignments done, taking a test is really difficult. Maybe you struggle with ADD or ADHD. So there are, if you reach out and try to seek help, there are accommodations that can be made. There are letters that we can write as healthcare professionals that say that this person needs some accommodations or maybe more time in taking a test, or, more whatever accommodations that are necessary pertaining to whatever illness you're struggling with. So there are options. Don't ever feel like because I have a mental illness, I won't be successful. There are quite a few people who are very successful who do struggle, but it is all about symptom management. It can be managed, and you can lead a successful and healthy life, if you're on top of it, and you gain the same, or the, support from people who care about you. So, like I said, it's about education. It's about understanding, you know, what is the difference between a mental health condition or just something, difficult that I'm going through. And that's okay too, because a lot of times people hesitate to seek out therapy because they think, well, you know, I'm not depressed. I don't have anxiety. I'm just struggling right now. And that's okay. If you need to get through some portion of whatever's going on and you need to reach out and talk to somebody for that time, go ahead. Therapy can be different for different people. It can be something that helps people who have struggled with a lifelong, you know, things like trauma or abuse and things that have gone on that have really impacted you, or it can be for situational conditions that happen. Something happened, there's a job loss, there's a divorce, there's a death, and you need to help, need help to get through that time. That's fine too. Or you just need somewhere to go and kind of check in and talk about what's going on, how you've been reacting, and it's maybe a place for self-awareness and self-growth. So it can be different things for different people, and that's okay. Whatever works for you, whatever helps you. So I would encourage, everybody to just learn more about mental health and be aware of these conditions and symptoms. And if you notice things about people that you care about that are changing, if you notice about yourself, reach out and talk to somebody, and hopefully that can, make a difference for you guys. That's all I got.
Alhamdulillah, Jazakallah khair, Sister Saima, for that informative presentation. And now we will begin our question and answer session of the webinar. So if you have any questions you'd like to ask Sister Saima, please text them in the chat box below. I will begin. Why do you think that there is such a stigma when speaking about mental health, particularly in the Muslim community?
I think, a lot of this, I think, over the past years, I think early on, you remember movies about, insane asylums, right? That's what they used to call them, insane asylums. It was depicted in such a way that it was kind of like, oh my gosh, if you have some sort of a mental illness, you're crazy, basically. There's something wrong with you completely. You're off, because it's not about, like diabetes, or it's not a heart condition where there's, blood sugar levels you can check, or there's your cholesterol levels that you can check, and you can, look at it's behavior, it's thought process, it's actions. And if those are off, we think, okay, and again, that stigma about something's wrong with my brain, that is also something that people think about. And it's like I said, it's been depicted in such a way in the past. Fortunately, that's changing now, and it is becoming like any other health issue. Mental health is a health issue. It's not, that you're crazy. I think for the Muslim community, maybe, I think culturally, there is a lot of maybe, we want to keep it within, we don't want, what will others say? I think it's hard to say, it's about judgment. It's about, in many, previous times, a lack of education, there's ideas of, maybe supernatural things that are impacting somebody's behaviors and that kind of thing. And there is, there are people in that part of the world do think along those lines sometimes. And again, it comes from maybe a lack of, awareness and the lack of education. And the more we talk about it, the more we understand it is something going on, physically in our bodies. There's neurotransmitters in our brains that if they're not at the levels we need them to be, like serotonin, dopamine, all these things, then it's going to impact the way we feel, and our behaviors are going to be different. So
what should I do if I know someone who appears to show signs of mental illness?
Well, I think it depends on, how close are you with this person, right? Can you talk to them? Can you say, hey, I love you as a friend, as a brother, as cousin, whatever, and I'm coming from a place of love and concern, and I'm not trying to be critical or judgmental. I've just been noticing these things, help me understand. I mean, do you see it? Help me understand if I'm wrong. Get them involved in that conversation. Don't come at them at like, what, you need to this, and you don't become attacking or I guess aggressive in that way. Try to be inclusive in the conversation. Like, what, I'm feeling this. I'm coming to you because I'm concerned. I love you. I care about you. Help me understand what's been going on. I'm here. So just trying to be that encouraging, supportive person for them.
Good, very good. What are some treatments other than medication can I do to promote positive mental health?
Yeah, so I mentioned, there's a lot of research now about, what's it called? Integrative medication. So there's a lot more ways of treating, looking really, with our taking a blood test and seeing where your levels are of different vitamins, minerals. Are you low in, what are you low in? I think, the big things are like, we all hear about vitamin D, B12, and these kinds of things. And there are medical professionals out there that do more extensive testing to see what's really going on more at a molecular level. They'll do, even things like stool tests to see what your gut health looks like. And, that's going to be my next topic about the relationship between gut health and mental health, because there is a big link there. So just kind of overall, if you wanted to avoid, psychiatric medication right off the bat, there are different healthcare providers that provide these other alternative forms of testing that can just kind of see what else is going on in your body physically that might be contributing to the way you're feeling. Different exposures to, to different nutrients that are in your body and how they're impacting you. So I would encourage people to look into that. Unfortunately, a lot of those treatments aren't covered by insurance, so they can become a little costly. But it just depends on what you feel that you want to do for yourself and which route for treatment you want to take.
Okay. And finally, to me, this is an important question. If I've made a decision with my doctor to treat my mental illness with medication, what do I need to know? What can I expect?
Well, I would encourage, if you're working with your doctor and you've agreed to whatever the doctor's recommendations are and what they've prescribed, to, follow up regularly. Don't miss them. Don't miss medications. Take it as prescribed. That's very important with psychiatric medications, because if you skip a dose or you skip a few days, it needs to be in your system at a therapeutic level. So having those, missed doses really can impact you in a negative way. So that's one thing for sure you have to be careful of. Having regular follow-ups. There are certain medications do have side effects. Every medication reacts differently with people because your biological makeup is different. So what one medication may work great where somebody that that same medication may not work so well for you. So if you're, and it takes time for these medications to get into your system, and it can take from 2 to 3 or 4 to 6 weeks even sometimes to be in there and doing what it's supposed to be doing. So doctors, psychiatrists normally want to follow up with you after maybe initially the first 2 weeks, then after a month, then once it's kind of more regular, then after every 3 months. So you want to follow up pretty consistent, very consistently. You want to be on top of that. And the minute you start noticing side effects, like if you're taking something, let's say for depression or anxiety, right? And you start to notice that I'm gaining weight, or I'm not sleeping well anymore, or my appetite's gone. These things, or you feel kind of like, a lot of people report just feeling kind of flat and numb and not feeling anything, and they don't like that feeling. So whatever it is, talk about it with your doctor. And ideally you want to have a doctor that's going to listen to you, who you trust, who will pay attention. And, if you don't feel you're getting the care that you want to be getting, it's okay to change doctors. It's okay to get a second opinion. So don't be afraid of that either. And again, like I said, if there are people, again, sometimes we don't notice things ourselves. So if people point it out to you that, hey, I'm noticing some of these differences over the last few weeks, you might want to think about it. Be open to that. Don't feel like that's a criticism coming towards you. So listening to other people as well.
Jazakallah khair. I'd like to sincerely thank Sister Saima for her presentation, and thank you all for tuning in to Family First Center's weekly webinar. Be sure to meet us here each week, where we'll be discussing a different topic every Wednesday at 11 a.m. Tomorrow is going to be Thanksgiving, so happy Thanksgiving, everyone.
Happy Thanksgiving. Stay safe.
Yes, please be safe.
Please stay safe.
Okay, Assalamu alaikum.
Assalamu alaikum.